Now to a little medical news today. For roughly 1 in 8 U.S. patients who have been diagnosed with non-small cell lung cancer, knowing their biomarker status could unlock the door and help their treatments. Sounds like exciting news. Well, we wanted to learn a little bit more about that. So we went ahead and invited Dr. Martin Dietrich to our show today to talk about this and maybe what we need to know at home and whether we're facing a diagnosis and just being able to get more information. First off, how are you today, doctor?
Good. How are you doing?
I am well, thank you. So let's go ahead. Let's dive right in. What is this particular form of lung cancer? Before we got started, I had never really heard of this kind, and I know that's specifically what we are focusing on today.
Well, as you can tell from the name, non-small cell lung cancer was a descriptive diagnosis of the cells not being small. It's the most common kind of lung cancer, but we've learned so much more about lung cancer at this point. And the most common mutation in non-small cell lung cancer is called KRAS. KRAS G12C is one of many discoveries we've made in the genetic space and has now become actionable. So we've seen great progress with great new opportunities for patients with new medications arriving in the market almost every month. So it's very, very important to understand that lung cancer is not one diagnosis, but it's really partitioned into a great number of subsets that are actionable.
Really? Okay, so let's talk about when you hear this, what exactly is this type of lung cancer that you're focusing on today?
Well, we're talking mainly about locally advanced and metastatic lung cancer, meaning lung cancer that has really left the restraints of resectability, of surgery, and of radiation. So disease that really needs a solution that reaches every compartment of the body. So we're talking about this definition of KRAS or the KRAS mutation as being the most important feature of this lung cancer when we start thinking about treatment options.
So where does this biomarker that I was just talking about at the beginning of this interview, where does that fall in, and why is knowing that biomarker so key and maybe can help the treatment?
Well, if you think back how we used to treat lung cancer, we had these one-size-fits-all approaches like chemotherapy. And obviously they didn't work really well because obviously everybody's cancer is different. It's like a fingerprint that is unique to each patient. And by understanding and fingerprinting these cancers through molecular testing and biomarker testing, we really find keys to locks that were previously closed to us. And KRAS being the most common one. 1 in 8 patients, as you mentioned, this is 1 out of 230,000 patients a year, or 30 to 40,000 cases that are diagnosed with this mutation. So it affects a great number of patients for which now an additional opportunity has become available through approval by the FDA in recent months.
So what should does a patient need to ask about this biomarker test? Because does it happen automatically, or what do they need to know in that test to be able to provide them and their doctor some maybe helpful answers?
Well, it's important to have a discussion with your healthcare provider up front. When you get diagnosed with non-small cell lung cancer, there are a number of important questions to ask. And one of the most important ones are surrounding biomarker testing, getting the information either from the tumor type, from the tumor biopsy directly, or from a blood test, and then having that result available at the time the decision for treatment is made to really map out the best treatment options for a patient that matches the patient in general and the patient's tumor type in particular. And these genetic markers or biomarkers are really what helps decide the individual treatment decisions.
Well, in closing, what are you seeing? What are you seeing in your practice as far as patients who have this treatment? Are there significant results that you can speak about?
Yeah, so obviously those are anecdotes. We've seen this in larger clinical trials as well. This is a medication named Lumagras that is very specific to the mutated type. So it spares healthy cells and really focuses on the lung cancer cells that have this specific mutation. It's not for every patient.
Okay.
Those patients are doing well. They're living their lives. They don't have the typical chemotherapy side effects of hair loss and nausea, and all the other things that we're seeing with non-specific treatments. And they really have an extension of good quality of life and also in their quantity of life. So this is an amazing step forward, and we're really grateful to have this. This has been a 40-year work in progress, and finally materialized in a solution that reached patients.
Oh, I'm so glad to hear that. Thank you for sharing how long this has been in the works, and of course, where people can go for more information. Dr. Dietrich, thanks for being with us today.
Absolutely. Thank you so much. And if you're asking about more information, lumacras.com has an additional set of information for healthcare providers and patients as well.
Wonderful. Thanks again.